Your doctor just said Adderall might help your focus problems. Now you're up at 3 a.m. worried about scary side effects. Will it change your personality? Will it make your heart race? Could you get hooked on it? We'll talk about this, and towards the end, I'll also give you 5 essential tips for ADHD other than medications. Hi, I'm Dr. A. I'm an integrative psychiatrist. Today, I'll share 5 key things every woman over 40 should know about Adderall. Stuff your doctor probably didn't have time to tell you. Number 1. What is Adderall? Adderall is a medication used to treat ADHD and narcolepsy. It contains amphetamine and dextroamphetamine. These are central nervous system stimulants that increase dopamine and norepinephrine in the brain, improving focus, attention, and impulse control. With ADHD, the conductor, your focus control, can't keep all the musicians playing together. Adderall gives that conductor a louder voice. This matters for women over 40 because hormone changes during menopause can make ADHD symptoms worse or show up for the first time. A study found that when estrogen drops, it affects the same brain chemicals that Adderall works on. This is why many women start having trouble with focus, staying organized, and memory during this time of life. Number 2. How does Adderall work and when? Adderall works by increasing dopamine and norepinephrine levels in the brain. It stimulates specific brain pathways that regulate alertness and executive function, helping manage symptoms of ADHD and narcolepsy. Adderall doesn't necessarily work the same way in women over 40 as it does in women in their 20s. Hormonal changes in midlife, especially shifts in estrogen, directly impact how your brain processes stimulant medications. What once felt smooth and steady may now feel too strong, weak, or unpredictable. How well Adderall works depends on when you take it, how much you take, and your body's unique makeup. Studies show that estrogen changes how your body responds to Adderall. As your estrogen goes up and down, your response to the medicine might change too. Some women say Adderall feels stronger at certain times in their cycle. Adderall generally works within 30 to 60 minutes of taking it. The regular kind lasts 4 to 6 hours. The extended release works for about 8 to 12 hours. Number 3. Side effects of Adderall. Let's talk about side effects. As you know, all medications have side effects, but that does not mean you'll have them. The most common side effects of Adderall are decreased appetite, dry mouth, trouble sleeping, faster heart rate, or blood pressure. For women over 40, these need special attention because changes in appetite can affect weight when your metabolism is already slowing down. Dry mouth can make dental problems worse. Sleep problems can add to menopause sleep issues. Heart effects need watching, especially if you already have heart concerns. But here's what many don't know. These side effects often depend on your dose and can be managed. A 2021 study found that starting with a low dose and slowly increasing it can reduce side effects. I've helped hundreds of women handle these side effects with simple steps like taking medicine earlier in the day to help with sleep, using sugar-free candy for dry mouth, planning regular meals to stay healthy, checking blood pressure often, and splitting the dose or using the extended release preparation once a day. One common side effect to watch out for is anxiety. Many women feel more anxious on Adderall. This can be extra hard during menopause when anxiety might already be high due to hormone shifts. Number 4, dependence versus addiction. Now, for the worry that stops many women from trying Adderall, will I get addicted? There's a big difference between physical dependence and addiction that often gets mixed up. Physical dependence means your body gets used to the medicine. You might feel withdrawal symptoms if you stop suddenly. This happens with many medicines, including antidepressants. Addiction is different. It means you seek the drug in a harmful way despite bad consequences. Research that followed adults with ADHD taking stimulants for over 10 years found that proper use did not increase addiction risk. In fact, treatment reduces impulsive behaviors that can lead to addiction. For women over 40, the risk of misuse is actually lower than in younger groups. A large study found that women over 40 had the lowest rates of stimulant misuse among all groups studied. That said, if you or your family member has a history of substance problems, talk openly with your doctor. Other non-stimulant medicines might be better for you. Number 5. how to get the most benefit from Adderall. The best approach isn't just Adderall alone. It's Adderall plus lifestyle changes that address the unique challenges women over 40 face. Here's what research shows works well with medication. Balance your hormones. A study found that women who addressed hormone imbalances along with ADHD treatment had better results. So consider hormone therapy if this is appropriate for you. Eat anti-inflammatory foods. Research shows that inflammation can worsen ADHD symptoms and reduce how well medications work. Eat foods rich in omega-3s like salmon, walnuts, and flax seeds, which help brain function. Exercise regularly. A 30-minute morning workout boosts the same brain chemicals as Adderall. A study found that women who exercised before taking their medicine needed lower doses for the same benefits. Control blood sugar. Spikes and drops in blood sugar can affect how well Adderall works. Research shows that eating enough protein and reducing refined carbs is beneficial. Improve sleep. Poor sleep makes Adderall less effective and side effects worse. Go to bed and wake up at the same time every day. Try magnesium glycinate, 300 to 400 milligrams before bed. Supplements can be beneficial for optimum brain functioning. In this video, I talk about 5 brain supplements every woman over 40 needs to know.